Okay. Knock, knock. Hello, my name is Sarah. I'm going to be your nurse for today. How are you? Okay. And I'm going to wash my hands. And I have my MAR right here. Mr. Akana, can you state your name and date of birth for me? Keola Akana, date of birth 12/4. Keola Akana, date of birth 12/4. Mr. Akana, do you have any allergies? No, I do not have any allergies. I'm checking his band, no known allergies, and he is not wearing an allergy band. Okay, I'm going to verify the MR number, 844-2515. 844-2515. Okay. All right, Mr. Akana, we're going to be doing a full head to toe assessment on you today, okay? I'm going to start off with some vital signs. The patient's heart rate is 96. Blood pressure is 152/95. O2 sats are 89%. So that is where I would try to get his O2 sats up, and I would put oxygen on the patient per the doctor's orders. Okay, we have a temperature. Taking the temperature, it reads a 98.7. And I'm going to take his respirations for 30 seconds. Okay, his respirations are 28. Mr. Akana, are you in any pain today? The patient states that he is in pain. On a scale from 1 to 10, can you tell me what your pain is? He states that is a 3 out of 10. And can you tell me where the pain is? It says his head. Is it radiating? He states that it is non-radiating. Can you tell me what makes it worse? He states that light makes it worse. And can you tell me what makes it better? And he states that there is nothing that relieves his pain. Okay, and can you describe that? And he states that the lights look funny and that he's seeing a yellowish green color. Okay. Mr. Akana, can you tell me where you are today? Okay. And can you tell me what date it is? And can you tell me why you're here? Okay, the patient is alert and oriented ×4. I don't know where my pen light went. Oh, it fell down. Whoa. Okay, I'm gonna shine this in your eyes. And then follow. Okay, so the patient's pupils are equal, round, and reactive to light, and they're also able to accommodate. I'm gonna check your mucous membrane. Say ah. Okay, the mucous membrane is pink, moist, and intact. I'm gonna check for skin turgor. Okay, and it is non-tenting. Mr. Akana, have you had a cough? He states that he does, or he has had a cough. Is it productive or non-productive? He states that it is productive. Can you describe the consistency of that sputum? He states that it is thin. And the color, he states that it is white. And he also states that when he coughs into a little medicine cup, he produces about 30 milliliters. Okay. So I'm going to inspect the chest before I auscultate, and chest is symmetrical. I'm going to listen to 8 places on the front as well as 10 places on the back. I won't be able to listen to 10 places on the back, but Okay, lung sounds, there are some crackles noted, and the respirations are deep and shallow. And I would listen to 10 spots on the back as well and find the same findings. Okay, so now I'm going to take a listen to your heart. I'm going to start off with the second intercostal space to the right, which is the aortic. S1, S2 noted. Second intercostal space to the left, which is the pulmonic. S1, S2 noted. Third intercostal space to the left is Erb's point. S1, S2. Fourth intercostal space to the left is the tricuspid. And then fifth intercostal space mid-clavicular line is the mitral. S1, S2 noted. I'm going to flip this over. And I'm going to listen for a full minute for the apical pulse. Okay. The apical pulse is 96 beats per minute and it's also irregular. Okay, so I'm going to assess for the pulses. I'm going to start with the brachial pulses and I'm going to check both sides to see if they are symmetrical. And I have +3 and they are both irregular. Brachial pulses, +3 irregular on both sides. Gonna assess for capillary refill on both sides. And it is less than 3 seconds. Okay, I need you to squeeze my hands, push down, and then pull up. And he has a strength of +5 on both sides as well. I'm gonna assess the IV site. There's no swelling, redness, or any infiltration. And also the bandage is dated for today and it is has the proper initials on there as well. Okay. All right, Mr. Akana, can you tell me when your last bowel movement was? He states that it was this morning. Can you tell me the color? He states that it is brown. The amount, large. The consistency states that it's watery, and he also states that it had a foul smell to it. Okay, so I'm gonna inspect the abdomen. The abdomen is flat. Gonna listen to 4 quadrants, starting with the right lower quadrant. Vowel sounds active, right upper quadrant. Vowel sounds active, left upper quadrant. Vowel sounds active, left lower quadrant. Vowel sounds are active. Okay. Now I'm going to palpate and I need you to tell me if you have any pain or tenderness. Right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. No? Okay. So the patient states that there is no pain or tenderness when palpating the abdomen. Okay. Mr. Akana, when was the last time that you urinated? He states that it was about 8 hours ago. About how much? He states that 10 milliliters. The color was amber, he said. The consistency, he said that it was clear. And if there was any odor, he said that it smelled like a strong ammonia. Did you have any pain, urgency, or frequency? The patient denies any pain or urgency, but he does state that there was a decrease in frequency. Okay, so now I'm going to lift up the patient's gown and I'm going to assess the patient's genitalia for any lesions, edema, abnormalities, discharge or sores. And the patient does not appear to have any of those. So I'm going to put the gown back. Okay, and I'm going to move down to the legs. Going to assess for edema on both sides. And there's a +3 pitting edema in both of his legs. I'm going to assess the overall skin. So I'm going to touch the back of my hand to his legs. His skin feels warm to touch. It's also dry, and the patient's skin color is appropriate to ethnicity. There's no abnormalities, lesions, sores, any of that noted on the patient's skin. Okay, so this is the point where I would stop before touching the feet. I'm going to wash my hands, and I do not have any gloves with me until I go get supplies from the school, so I'm just going to verbalize that at this point I would put gloves on before touching the patient's feet. Okay, so I'm going to assess for the pulses. Posterior tibialis, feels non-palpable, probably due to the +3 pitting edema. The dorsalis pedis is also non-palpable due to the edema, and I did check those pulses on both sides, so they are both equal bilateral. I'm going to assess for capillary refill, which is greater than 3 seconds on both sides. I'm going to assess for the strength, so I'm going to need you to push down and pull up. And the patient does have a +5 strength on both sides. Okay, so at this point, before doing anything else, I'm going to take off my gloves, and I'm going to wash my hands before touching anything else. Okay, and then I would pull the sheet back down for the patient, and we are all done. Mr. Akana, I just finished up my assessment. Is there anything else that I could do for you right now? He states that there isn't. I'm going to put the bed all the way down for the patient's safety. Here is your call bell in your hand. If you need anything, feel free to push that call bell. And I'm going to wash my hands again. And I'm going to open up the door for privacy, and I would call the doctor to report my findings.